Hello, we are the South Notts Community Therapy Teams. Our teams consist of several disciplines including physiotherapists, occupational therapists, assistant practitioners and support workers. Before COVID, we worked together to provide therapeutic intervention for individuals within their home environment with the aim of maximising independence and quality of life. This included rapid response intervention to help people return home from hospital early or to prevent a hospital admission, rehabilitation, falls assessments and treatment, and palliative care. Our aim was also to positively promote and maintain the functional abilities of patients with long-term conditions. The average age of people receiving the service was 78. However, our caseloads range from 28 to 100, demonstrating the breadth of our service. Examples of our interventions include providing exercise programs to build strength and balance, measuring and ordering equipment to enable a person to participate in their everyday activities, and offering support worker visits to practice the skills required to return to independence with making a meal. At the beginning of COVID, we were asked to reduce the number of face-to-face visits in order to reduce the spread of the virus, but we maintained a service for those most at risk of being admitted to hospital and to support early discharge.
Hi, my name's Colette. I'm a physiotherapist working in Rushcliffe Community Therapy Team. I predominantly work with older people. I'm going to introduce you to John. He's a patient that was discharged from hospital following sepsis and COVID. He's going to tell you about his experiences within our service with physiotherapists.
My name is John. And I've been receiving physio for the past 3 months, which has greatly improved my mobility. The reason being was that I was in the hospital for a total of 7 weeks, having sepsis and then contracting COVID. I lost all use of my legs and I felt very, very weak. I lost 1.5 stone in weight. I had no appetite. I couldn't smell. I couldn't taste. In fact, I was in a complete mess. I was discharged and came to live with my daughter to convalesce, who's been absolutely wonderful. In fact, now as far as the physio is concerned, I've had continual treatment from them, which has improved my mobility considerably. So I can now get up and down the stairs, which of course I couldn't before. I had to get a stair lift in. I did a selection of exercises, and it was exercises initially with my legs and the whole of my body, which did in fact improve my mobility considerably. I can now walk up and down the stairs with the aid of a stick and handrail, which of course I couldn't do before. My experience is such that without them I would not be where I am today, and that is that I can, my mobility is very, very much better. They were very considerate in the way that they dealt with my problem. They did not wish to overtime me, and the whole project was paced so I could do the exercises and the walking within my limits without undue stress. They also, I mean, the attention I had was for quite a number of weeks was daily. They visited me daily and helped me daily. They provided equipment. I have sticks. They provided the sticks, which I still have with me, and which without them I would not be able to progress the way I have.
As life with COVID becomes our new reality, the routine face-to-face aspect of our services has resumed. Our focus has been to rebuild our services, and we have seen an increase in referrals. This has included people recovering from COVID-19, those whose health and function are at risk due to pauses in planned care during lockdown, those who avoided health services during the peak of the pandemic, and those dealing with the physical and mental effects of lockdown. Our service has a key role in reintegrating people back into society after lockdown, using our skills in restoring function and confidence. Physios and OT's holistic approach will help address the mental and physical impact lockdown has had on people. Responding to the pandemic has presented challenges. However, it's also provided an opportunity to reflect on our practices and develop new ways of working which we want to take forward. We have continued to call all patients at the point of referral and through thorough triage decide if their needs can be met without a visit. When appropriate, we will assess and provide intervention over the phone, including promoting guided self-management, providing resources through the post or signposting to online resources. By reserving face-to-face visits for those with the most need, we can offer a timelier response. This initial triage also enables us to get a head start on our treatments and interventions, which can reduce the length of the first visit and reduce the number of visits required, for example, ordering equipment needed for the face-to-face assessment. We will continue to use technology as an adjunct to our assessments and interventions. Asking a patient to email photos of their environment pre-visit or holding a video conference with an equipment rep from Sheffield can increase the efficiency of our input, and we cannot return to our old traditional ways. During COVID, the therapy teams across South Notts have pulled together and strong bonds have been formed. It has shown us we are stronger together. United, we will be able to rise to the challenges left by the legacy of COVID, which will be with us for many years to come.